In this podcast episode, Dr. Sarah Wakeman, a Harvard professor and addiction expert, delves into the complex relationship between alcohol consumption, addiction, and health risks, particularly cancer. The conversation covers a range of topics, from the biological effects of alcohol on the brain to the societal implications of addiction. Dr. Wakeman begins by addressing a common misconception about alcohol consumption. Many people believe that moderate drinking is harmless or even beneficial. However, she emphasizes that the threshold for health-related problems is much lower than most individuals realize. For instance, consuming just one glass of wine daily can place a person at what is termed moderate risk, which is associated with an increased likelihood of developing various forms of cancer. This risk escalates significantly with higher consumption levels, with 2 glasses potentially increasing cancer risk by 40%. The discussion highlights the importance of understanding these risks, especially in a culture that often normalizes daily drinking. Dr. Wakeman points out that misinformation surrounding alcohol consumption can lead to dangerous habits, as many individuals are unaware of the potential health consequences associated with even seemingly moderate drinking. This lack of awareness can contribute to a cycle of addiction and health deterioration. One of the most alarming aspects of alcohol consumption is its effect on the brain. Dr. Wakeman explains that alcohol can cause significant brain damage over time, leading to cognitive decline that resembles dementia. She shares a striking comparison. A 43-year-old individual with a history of heavy drinking may exhibit brain changes similar to those of a 90-year-old with dementia. This highlights the profound impact that alcohol can have on mental health and cognitive function. The mechanisms behind this brain damage are multifaceted. Alcohol affects neurotransmitter systems, particularly those related to pain relief and anxiety. When individuals consume alcohol, it activates their natural painkiller systems, leading to temporary relief from emotional or physical pain. However, this relief is short-lived and can lead to a cycle of increased consumption as individuals seek to replicate that feeling. Over time, this can result in structural changes in the brain, further exacerbating cognitive decline and emotional instability. Dr. Wakeman discusses the factors that drive individuals to substance use, emphasizing the interplay between genetics and trauma. Research indicates that genetics account for approximately 40 to 60% of a person's risk for developing an addiction. However, the other half of the equation is often rooted in traumatic experiences. Many individuals turn to substances like alcohol as a coping mechanism for emotional or physical pain stemming from past traumas. This understanding is crucial for addressing addiction effectively. By recognizing that addiction is not merely a matter of willpower or moral failing, but rather a complex interplay of biological and environmental factors, we can approach treatment with greater empathy and effectiveness. Dr. Wakeman advocates for a more compassionate view of addiction, one that acknowledges the underlying issues that contribute to substance use. The conversation shifts to the effectiveness of traditional rehab programs in treating addiction. Dr. Wakeman expresses skepticism about the conventional model of rehab, which often involves short-term stays in facilities that may not provide the most effective treatments. She argues that many rehab programs fail to offer evidence-based therapies and medications that have been shown to be effective in treating addiction. Instead of viewing addiction as a problem that can be solved in a few weeks, Dr. Wakeman emphasizes the need for ongoing support and treatment. She highlights the importance of integrating addiction care into the broader healthcare system, ensuring that individuals receive comprehensive support tailored to their unique needs. This approach can help individuals navigate the complexities of recovery and build healthier lives. Dr. Wakeman advocates for the use of evidence-based treatments in addressing addiction. She explains that medications can play a crucial role in helping individuals reduce their alcohol consumption and manage cravings. For example, certain medications can block the pleasurable effects of alcohol, making it less rewarding for individuals to drink. This pharmacological support, combined with psychotherapy, can significantly improve outcomes for those struggling with addiction. The discussion underscores the need for a paradigm shift in how we approach addiction treatment. Rather than relying solely on traditional rehab models, we should prioritize evidence-based interventions that have been proven to work. This includes not only medications, but also therapeutic approaches that address the underlying psychological and emotional factors contributing to substance use. Stigma is a pervasive issue that affects individuals struggling with addiction. Dr. Wakeman highlights how societal perceptions of addiction can create barriers to seeking help. Many people view addiction as a moral failing or a sign of weakness, which can lead to feelings of shame and isolation for those affected. This stigma can prevent individuals from reaching out for support or accessing necessary treatment. To combat this stigma, Dr. Wakeman emphasizes the importance of changing the language we use when discussing addiction. Terms like substance abuse and addict can perpetuate negative stereotypes and reinforce the idea that individuals with addiction are somehow less deserving of compassion and care. By adopting more empathetic language, we can foster a more supportive environment for those seeking help. Dr. Wakeman discusses the significance of community and connection in preventing and treating addiction. She explains that social isolation can be a significant risk factor for substance use, as individuals may turn to alcohol or drugs as a means of coping with loneliness. Building strong social networks and fostering connections can help mitigate these risks and provide individuals with the support they need to navigate challenges. The concept of rat park is introduced as a powerful illustration of this idea. In experiments with rats, those placed in enriched environments with social connections were less likely to engage in substance use compared to those isolated in barren cages. This underscores the importance of creating supportive communities that promote healthy behaviors and provide individuals with a sense of belonging. When it comes to making lasting changes, personal goals and motivation play a crucial role. Dr. Wakeman emphasizes that individuals are more likely to succeed in reducing their alcohol consumption when they have clear, meaningful reasons for doing so. Rather than focusing solely on the negative consequences of drinking, individuals should identify the positive outcomes they hope to achieve by making changes. This approach encourages individuals to reflect on their values and aspirations, helping them to create a vision for their future that aligns with their goals. By focusing on the benefits of change rather than the drawbacks of their current behavior, individuals can cultivate a sense of agency and empowerment in their recovery journey. Therapy is a vital component of addiction treatment, providing individuals with the tools and support they need to navigate their recovery. Dr. Wakeman discusses the importance of finding a therapist who is empathetic and well-trained in evidence-based approaches. A strong therapeutic alliance can significantly enhance the effectiveness of treatment, as individuals feel more comfortable sharing their experiences and challenges. In therapy, individuals can explore the underlying issues contributing to their substance use, develop coping strategies, and work towards building healthier relationships. This process of self-discovery and healing is essential for long-term recovery, as it allows individuals to address the root causes of their addiction and develop a more positive self-identity. As the conversation draws to a close, Dr. Wakeman reflects on the future of addiction treatment. She expresses hope for a more compassionate and evidence-based approach that prioritizes the needs of individuals struggling with addiction. By integrating addiction care into the broader healthcare system and promoting awareness of the complexities of addiction, we can create a more supportive environment for those seeking help. The discussion highlights the importance of continued research and innovation in addiction treatment. As our understanding of addiction evolves, so too should our approaches to prevention and care. By embracing new ideas and methodologies, we can work towards reducing the stigma surrounding addiction and improving outcomes for individuals and families affected by substance use.